Hello, I'm Dr. Don Henderson, Director for the Doctor of Healthcare Administration program at LECOM. Today, we'll examine a critical issue facing our healthcare system, the survival of rural hospitals over the next decade. We'll explore the financial, staffing, and demographic challenges these hospitals face, and then discuss potential strategies and policy solutions to ensure that rural communities continue to have access to essential healthcare services. Let's dive in. Of the current 5,100 community hospitals in the United States, about 1/3 or 1,800 are currently classified as rural. However, of these 1,800, at least 700 hospitals currently have negative operating margins and are in danger of closing. This is in spite of about 1,300 of these hospitals being designated as critical access hospitals with favorable cost-based reimbursement from CMS. Some of the main issues facing rural hospitals at present are recent cutbacks in Medicaid funding levels and coverage enacted by the U.S. Congress may make the current situation worse. Staffing issues. Hospitals are grappling with physician and nurse burnout and a shortage of both physician and nursing providers. There is also a perception in the current generation that the quality of life may be lessened in rural areas. More than half of rural physicians are over age 50 at present, which means by 2030 there will be about a 25% vacancy in rural medical practices in the current situation. Rural communities are seeing declining population, which reduces the local number of patients available to be seen. Finally, many rural hospitals were built from the 1950s to the 1970s under the Hill-Burton Act. These facilities are currently at the end of their useful life with no federal programs available to fund replacement facilities. If a rural hospital closes in a particular area, in many cases, it's the county's main employer. Therefore, because communities are competitively evaluated by industries based on education, the quality of medical care, and local living conditions, in many cases, the closure of the local hospital is a death knell for the future economic prospects of a particular area. What then, if anything, can be done to address this issue in 2025? The critical access hospital designation needs to be expanded to cover all of the remaining rural hospitals, which is currently limited by a 35-mile proximity rule. CAH funding needs to be increased, with rural rates adjusted to be closer to urban areas for Medicare and Medicaid patients who make up the bulk of these local rural populations. Federally qualified healthcare clinic reimbursement levels need to be extended to all rural hospital settings and not cut back as is currently planned by CMS. This will help rural hospitals establish primary care clinics, which can then attract enough of a patient base to keep the local hospital functioning. Telemedicine can be implemented and used to address physician staffing shortages in specialty areas. For this to work, partnerships need to be established with larger urban hospital systems, which should also be incentivized financially to help make these arrangements. A new rural hospital facility model needs to be standardized using modern technology to provide an appropriate level of hospital care. And from there, a new funding mechanism must be established to replace the Hill-Burton Act. This could be a loan program which could be supported by the local governmental entity. In conclusion, the annual closure rate of rural hospitals has expanded from an average of about 20 per year to an annualized rate about 80 hospitals closing in the current year. In addition, about 70 additional rural hospitals have closed their labor and delivery units this year alone. This shows that rural hospitals can no longer afford these types of services. This also means that over time, rural residents and pregnant women may need to travel at least an hour to find emergency, critical care, and obstetrical services. This shows that there needs to be an immediate and urgent action taken by Congress to address these issues. Recent rural hospital closures have indicated that once a closure takes place, there is a point of no return, and almost 100% of rural hospitals that have closed will never reopen. We would urge policymakers to not continue to ignore this growing national medical issue. If you enjoyed what you heard today and want to dive deeper into topics like this, consider applying to LECOM's Doctor of Healthcare Administration program. Join us and take the next step in advancing your leadership and expertise in healthcare.